our day. So, starting off with positive thoughts, like you have your teaching channel, that's awesome because that's purpose aligned. As Coach always talks about purpose and how
Yeah.
purpose leads to
Okay. All right.
your
Thank you
purpose
so much.
leads to, yes, it leads to not only a sense and a feeling of accomplishment, but it leads to joy. So it brings joy to your life.
Okay. Thank you so much. I never knew that hugging is part of something that helps someone in that situation. I never knew. I just heard of it. Thank you so much.
Yes.
Yes, so Mama Obejo, make sure your children, you hug them all the time. Even if you're not feeling, you don't have other feelings. Hug, hug, hug.
Yes.
Yeah, yeah. Thank you so much.
Wellness Revolution talks about if you feel that way, also you can break down tasks into small, like you can perform the most important tasks. You don't have to be overwhelmed to do everything at once. You break them down. That one is workable. I've done that, so I know that is workable. Meditation, doing
Yeah,
prayers, practicing deep breath the way she has just shown us.
yeah.
You can even raise your hands up, down, very effective. I've not raised my hands up, but I'll start doing that also. So, yeah, you
Yeah,
already have tips.
I've
You
been
already
doing
have
that.
tips.
I've been doing the raising of hand and the other ones. Yes.
Oh, wow.
Yeah. Yeah.
Nice.
But I didn't know
And
that
especially
hugging
your
is.
question was about when nobody is there, you don't need
Yeah.
assistance. And that was a wonderful question.
Yeah.
That was
Thank you so much, Deora.
Yes, you're welcome, Ma.
positive self-talk. I love the way Coach Liz, you put your affirmations. Wow, it was amazing. It was amazing. Those are the examples of affirmative. You have also to align it with your purpose, like you. Everybody should have affirmatives. They encourage you. It's a positive talk. You talk to yourself every single day. And what you feed your mind becomes what you. So what you feed all the time, it gets that system. If you always tell yourself bad things, that is it feeds.
Yeah.
So what you feed is what you
Yeah.
become.
That's right.
Thank
Yeah.
you so much, everybody. Any other question, any submission as well? Any other person? You have a question? I know people who have a lot and they don't want to talk about it.
Yeah.
If you don't feel shy, don't feel shy. Just bring it out, and you're going to help get some help. It might not be you. It can be your cousin. It can be a relative who is going through a particular phase of life. Behavior talks, Coach Liz, is to some people traveling can cause that trigger they get mental disorders, like changing environment, like they didn't know they have a specific, it did not come out, but once they're in a different environment, it comes out. Because to be sincere, some people even go to church to be prayed. They have mental disorder. They get to be, instead of getting help from medically, they think it's demons, which are, because they have these hallucinations. So
Yeah, so Coach, you are absolutely right. Sometimes the environment you're in could trigger some trauma that you've experienced even in a religious environment. Not just church, you could be in a mosque, or if you have other beliefs, maybe you grew up as a Muslim and then you became a Christian when you were older. So it just depends on the mode in which you understand trauma. And one thing that I want to say with that, if you are in an environment that triggers some emotions, you want to breathe through it. And then you also want to have support, solicit support of people that can help you calm down, take a deep breath, walk you through it. There is a method and a mode of therapy, exposure training, and they gradually expose the person to the event. They may not take the person to the location, but at some point they may revisit the location in order to bring a desensitization to the environmental barriers or the environmental cues that trigger the trauma. But again, this is not you going to do it on your own. You are, again, as Dr. said, treated from a professional who knows the techniques and the skills. And when they can observe you, take baseline data, that's when you enter in, when you start working with them, what is your baseline data? And then they can say at what point you're ready to experience this exposure to decrease the ability for the trauma to affect you. So exposure training is a therapy method. Some people don't use it right away, and some people don't use it at all, depending on how much trauma the environment brings to the person. But like Wellness Revolution is saying, you definitely need a specialist. You cannot do it on your own because they are trying to at different points to treat different parts of the exposure training. It may have to shift or change. The intervention may have to change. So you can't do this on your own, but I'm just giving you an idea of how they treat like post-traumatic stress disorder or severe trauma that is tied to an event or an environment, location. Another thing that people can do is bring like a journal with them if they are out of town or traveling, because traveling in itself nowadays can be a whole stress event, like going to the airport, going with children, going with your family. That in itself can bring stress and anxiety. And so breathing through it, wearing the right shoes when you're in the airport, exercising or stretching. Stretching is very key to bring circulation to your body. So stretching and even bringing water with you, scheduling your trip to the airport, scheduling your trip out of town, being able for the whole family to sit. I believe Wellness Revolution was saying is sit at the dinner table together and have talks and discussions, praying together, being able to just be mindful in that situation, not being distracted, but hearing everyone communicating well. All of this is part of reducing stress. We call it antecedent interventions, things that you do before stress or the behavior that you're trying to reduce happens. You want to set the environment to reduce your stress. So waking up on time, having schedules, having things prepared, having your luggage packed before the day of, having extra whatever you need, snacks or extra, I don't know, a cold pack on your head. Putting a cold pack on your head can bring your anxiety down. All of these things help when we're traveling, and nothing replaces rest. So getting enough rest in the morning, waking up with, your snacks, breakfast, whatever you eat in the morning, eating well, having energy helps reduce stress and anxiety as well.
Thank you so much.
Okay.
Mama Obejo, you had something? I had as if you're talking. Thank you, everybody. Thank you for being here. We appreciate you. Thank you for taking your time. Remember, if you're not able to get the program, you don't have to worry. I'll have a way of making sure you get all the information that has been shared over here. Right now, we are just inviting people to share their experiences. If you have any question about mental health disorders, feel free to ask. Feel free to talk to us. If you're below, you can always comment in the comment section. We can always see you. If you want us to bring you up, also we can bring you up so that you're able to ask question. This is a very wonderful topic we have discussed today. If you're not able to capture something, you need to capture something. Coach Liz, if somebody was not in this live stream, how can you summarize this information for them at least to go with something home at least? Yeah, because we have discussed how to manage trauma, we have discussed environment triggers, we have discussed so many tips over here, breathing exercises. We have discussed a lot, but now when you want to summarize what we have just discussed, what can you tell someone who maybe has just joined, or if they're in FYP and they've just listened a little bit of what you're discussing?
If I could just summarize the points of discussion. So first we talked about the importance of not having social media and even the internet define mental health and what that means to you. Also being knowledgeable of stigmas and how public stigmas, family stigmas influence the treatment of mental health conditions. So sometimes being in a place of isolation or being made to feel that you're alone will exacerbate your situation and cause you to feel that no one can help you and you will never come out of it. Being able to seek professional help from doctors to psychologists to psychiatrists, having them coordinate your care. They need to communicate about your care as well. Having support from caregivers, family members, being able to understand that your mind plays a vital part in your wellness. Setting boundaries is very important. Sometimes people don't want to share their private health information, and that's perfectly fine. However, being able to seek someone that you can trust helps build a buffer to mental health diagnosis. And when we say buffer, we mean ways in which we can combat the mental health diagnosis and the effects that can cause other physiological, social, psychological, as well as physical trauma affects the body. It can rewire the brain and alter your mood as well as alter physical traits in your body. So being able to seek help to get this resolved is important. The longer that it is undone and unresolved, it could lead to other mental health or more serious mental health diagnosis. Again, autism spectrum disorder and some diagnoses, we're not trying to get rid of them or change the person. We are trying to give them resilience and coping mechanisms. Last but not least, 1 out of 4 adults have a disability, so don't feel alone. And this is a national statistic, not just in the US. And so at some point in your life, even if it's restricted mobility, it could be any disability that could affect you. 1 out of 4 adults will experience it. It can be environmentally caused, or it could be correlated with your disability. We need to just be graceful with our bodies, speak positive to our bodies, and get a hug. So ask for a hug, give a hug, recycle hugs. Hand hugs, physical touch and contact helps increase your happy hormones and it relieves stress. So thank you so much, Coach. This has been a very
Thank you. Even if they didn't hear you, when they had the hug, everybody had something. Continue hugging all the time, guys. Thank you so much. There's a question over here. I can't stop laughing. Why do most doctors quickly run in giving medication if they have any problems, especially
Yes. So I'm not against doctors. But I want to say that at one point I wanted to be a doctor, a physician, actually a pediatrician is what I wanted to do. However, doctors have certain amounts of training depending on what school of thought they follow and they accept. They accept something called a Hippocratic oath. So when you talk about the Hippocratic oath, if you ever look up the Hippocratic oath, and actually, doctor, can you come in and talk about this? This is a perfect question for you. And I want you to come in, Dr. Samoe. I'm sorry.
Shoyemi.
Shoyemi.
Soyemi, can
No
you
problem.
please answer? Can you please answer? And laughing is good medicine. Laughing is
Yes,
excellent medicine.
yes,
Can you answer
yes.
Wellness's question, doctor? It's in the chat.
But why are you pushing that question to me?
Because you are a doctor now,
Okay. It's an interesting question. Actually, I am a family physician, and the fact is that just like any specialist, any trained doctor, there are guidelines for management of patients globally, no matter which part of the world you are in. There are guidelines talking about global guidelines, whether it's World Health Organization or guidelines from mental health groups. So, as much as possible, we that are into specialties, we do as much as possible to follow those guidelines. But the fact is that many of those guidelines definitely include medications, especially where you have clear diagnosis. So when you say doctor, why are doctors? Let me read that question again. Why do most doctors? I like the fact that you said most doctors, not all doctors.
Not everyone. Yeah,
Yes,
most
not
doctors.
every doctor. Quickly run in giving medication if you have any problems, especially in America. Okay, me, I'm in Nigeria, so I'm free until Trump invites me.
Take him to Nigeria now. Why?
So, so the fact is that so I started by saying that I'm a family physician because I include this holistic approach to the care I offer as a family physician. So that holistic approach includes the fact that I manage patients in the context of their family and community. So we consider some social factors, belief systems, and all when it comes to management. So such individuals definitely benefit from counseling and all before we even talk about medications. Of course, when I have to follow the guidelines, I have to let the patient know that, oh, based on this diagnosis, these are the management protocols. These are the things we need to do for you. Apart from talking about mental health, for example, I've talked about the need for psychotherapy, and we talk about counseling for support. In fact, invitation as a family physician, I do not just do office consultations. I do home-based care, so I can organize family meetings. We call it family conference, where no matter which part of the world relatives or friends are, who are actually important to the care of the individual, we can have scheduled meetings. So before medications, of course, for emergencies, we'll let you know, oh, this is what needs to be done. You need to take this injection to help and all that. But for situations where it's not an emergency, of course, the patient has a right to accept taking medications or not. So when it comes to practice, my own practice is under that approach, is supervised by the use of guidelines in management of patients. So I know there are issues around people people celebrating what do you call it now, drugs, supporting farmers, companies, and all. So, but it's everywhere. But as much as my conscience, and then the fact that I have guidelines I have to follow, and I want the best for my patients, look beyond my own personal interest and then do the best for the patient. So if a patient does not need medications, I won't prescribe medications. Of course, I've had situations where I've had to tell a patient that please, you don't need any medication. You just need to get some rest, which you can do without medications. So that's it. Thank you. Thank you.
Thank you, Doc.
Thank you for your submission, even if you have gone the wrong route. Now, Dr. Swami, is there a time somebody came to you and you never prescribed anything? Like you did not prescribe because you saw they don't need medication. Maybe they needed somebody to talk to.
Exactly. You are right. There have been occasions like that, and it may even be something related to sleep, just sleep disturbance. It's not talking about insomnia. It may just be that individual has not had proper sleep, and this may be related to poor sleep hygiene and then demands of work, stress. And so we just need to cancel. If there's pain, of course, we give something for pain to take care of that. But if the patient has really no complaint other than, okay, I've not been able to sleep, I feel this, I feel that way. Occasionally, maybe medications, but there are occasions, no, most times, such individuals that present to the hospital may actually benefit from medications, but few do not need to take medication. So I've had occasions where I've needed to just cancel, and then because I'm as a family physician and as a medical doctor, I should offer that counseling. But by the time I'm referring a patient to see a behavioral medicine doctor or call them psychiatrist, then it may mean that that individual will benefit not just from psychotherapy, they may even benefit from medications. Thank you.
Thank you so much. Thank you.
Also, too, thank you, Doctor. We appreciate your perspective. As Sweeta is saying in the chat, some people they wait and they prolong.
Sorry, I had to clap for him.
They prolong their treatment.
Peter, thank you.
Yeah, and they go to the hospital when they're very sick. So it is an emergency, and that doctors are obligated to do no harm. So a part of even myself, the ethics, the bioethics of treating patients is to make sure that we are not putting them in a harmful situation. And this Hippocratic oath is a ancient Greek medical terminology or core ethical standards for physicians that they take. And that is talking about medical confidentiality and non-malfeasance. Is that correct, doctor? And that just means doing no harm to the patient.
Yes. Do no harm to the patient and benevolence.
Yeah. So the benevolence means that you're going to do the best to treat them under the jurisdiction that you're authorized and have the authority to cover, correct?
Yes, ma'am. So that's where we operate.
Thank you so much for that, being open and sharing that information. I know Mama Wellness knows a lot. He just wants to make this lively and also ask for other people questions. Thank you so much, Mama Wella. Another question. Why do men afraid of going?
That's good.
Why are men afraid of going to the
questions are coming in more.
Yes.
Interestingly, actually, research has shown.
She has given an example. My husband is an example. Oh my goodness. Wow. Okay. Go on, Dr. Shiremi.
Yes, research has shown that women present more to the hospital for care than men do. and there are many factors to that. One is that there are many peculiar phases in a woman's life, beginning with the fact that there's a first experience, for example, of menstruation, menarche, and there's the reproductive period, which may come with different challenges in between, and then the fact that it's a woman that gets pregnant and has to visit for antenatal care often, and then for postmenopausal, for the menopausal period, whether it's premenopausal, perimenopausal, or menopausal period, then there are challenges that also may arise that will require a woman to present to the hospital. Now, for men, okay, yes, that's just one major reason. And then let's look at other factors. You know, women seems to be more outspoken and willing to receive help. They talk about men ego and believe they can solve the problem by themselves. I don't need anybody until the situation gets worse and then becomes complicated. Interestingly, there are some that don't even talk to their wife or spouse or what do you call it, children, family, friends, until they enter into a complication and they have to bring them to the hospital. And then you discover that they've actually had a chronic condition which they never talked about. Then maybe, I'm not sure, maybe the financial aspects too. I believe especially now that the people can do over the counter medications, and then and there are seasons that, of course, there are areas where people consider more of herbal medicine, traditional, and then natural remedies. Even though that one, I'm not sure, maybe more men do that than more women do that than men when it comes to use of natural remedies. So those are some of the reasons why men don't actually present to the hospital. My dad never visited hospital. He was diagnosed of, oh, somebody just typed in that.
Yeah, that's serious.
Wow, serious. Okay, so in South Africa, healthcare is free, but it still don't go. Yes, so it has to do with attitude. Also, it has to do with exposure and understanding. Health education generally, if people are not aware that even having a headache may just mean more than stress, may mean that maybe someone has a tumor in their brain. They have awareness, like we keep doing health education, they will know that, oh, I shouldn't take this headache as just a simple thing. I need to get evaluated properly to be sure that it's not something deadly I'm dealing with here. So those are some of the factors. The more we do education, when they come to the clinic, for example, interestingly, I've had situations where it's a wife that actually brought her husband, and then I'll say thank you for bringing him. And some even say that, oh, how I wish you can talk to my husband to come to the hospital. I said, no, we can try, but if you can get him to come once, at least you let him know that he needs to keep coming. At least. So there's the art need for consciousness, health consciousness, and then doing regular medical checkups will go a long way. Being more preventive, proactive than reactive when health matters arise. Thank you.
Thank you so much, Dr. Soemi. Thank you. Sorry. Thank you. Sometimes you press buttons, you press the wrong one.
This one
Thank
is
you for-
interesting. African men especially think that infertility challenges are just a woman thing, and I'll be talking soon about this fertility thing. Do you know that? That's the fact, right, Coach?
Yeah, it's a
Vivetex?
fact.
But we know that it's even a man that, of course, when it comes to infertility, it could be based. It could be male factor, it could be female factor, it could be both. It could be a combination of both factors. So when we are evaluating, that's why when a woman presents for the first time, we're not just screening the woman. The man has to do a seminal fluid analysis, which is given, even if he doesn't come to the clinic, it is given to the wife to give to him most of the time. Thank you.
Goodness. That cannot be done in Africa. Thank you so much, Dora Soemi, for enlightenment. Because now maybe we may to be wondering, where are our husbands, where are our brothers, where are our fathers? They don't want to go to hospital. So maybe that ego may be financial, because you can get medication over the counter, maybe a lot of contribution. But now you can see some people get serious. So we need to make men talk. We don't know how, but Dr. Soemi, we need to make sure our men are talking, so that they don't get to dangerous stages of like the one we're having example over here. That's very serious. So thank you, everybody. Thank you so much for joining this particular live stream. We appreciate all of you. This live stream is PPA. It's combination of coaches all over the world. We have behavior talks, Coach Mwendo as well, and many people you're going to meet in this platform, sharing their experiences, impacting people's life, because our mission is making your life better, so that also we can better our lives. So thank you so much, Coach Liz, for being here and sharing this information about mental health disorders. I know we exhausted only a piece of it, but with time we can go step to step as particular type of disorder. So thank you so much. Anybody has any question? We don't want to leave someone.
Yes,
Our sweeter has a question.
Okay, I think they have questions. Okay, before that question, I just want to mention that it's always good to not ignore symptoms. I say that to individuals, but for men now, you need to be a bit more observant, especially for the elderly. You know, they don't talk, they don't want to talk. They just believe they don't want to probably disturb anyone. They are the leader, they shouldn't be seen as weak and all that. So you have to be observant. You need to ask questions. You need to be asking them questions. Hope you don't have any challenge, especially even common things like urinary tract infections, frequent urination at night. It may even be related to prostate. It may be related to diabetes. So before it gets into complications, we should be able to recognize these changes in them and help them. Thank you.
Thank you so much. You can go on Twitter. Coach Twitter.
Okay, thank you very much, Coach. Good morning, good afternoon, good evening, everyone, depending on where you are streaming from. Thank you so much, Coach, for all that you do. Thank you, Coach, and thank you, Behaviors, for this wonderful section. Thank you. My question has to do, since we're talking about mental health, I don't know if anyone can help. For someone that was involved in series of accidents, and afterwards the person now became traumatized, and the person is now having panic attacks when the person drives. So the person is now afraid to drive, but the person really wants to drive. You know, the person has been driving for a long time, but because of the whole thing that happened, the person cannot drive now. Do you know any way that that person can get help so that the person can be able to drive again? Because the person has stopped driving completely now, you know, because of all what has happened. Because when the person drives, the person tends to have panic attacks. So what can be done to help such a person to be able to drive again? Can the person even be able to drive again? Is it possible? Since we have doctors in the house, I don't know if anyone can help. Yeah, thank you. That's my question.
Yes, Liz is saying, and this is that is question. You have asked a question. All right.
So one of the things that they need to do is go and talk to their physician, the medical physician first, they can oftentimes give a referral to a psychologist, to someone who can treat the trauma surrounding the event. And then I have heard, like what I was saying, early exposure training. I have heard some research being done to treat, excuse me, panic attack and anxiety around accidents or, things that occurred at an event and it traumatized the person. So yes, they probably need to get a referral from their medical physician, and then from there they can work as a team to help the person. Maybe they want to even work with a behavior analyst once they coordinate the initial consultation with the psychologist. The behavior analyst will help give them specific treatment plans to address the trauma and also give them steps on how to get back into the mode of driving, because that's activity or was an activity of daily, like commuting, daily transportation for them. They were used to that activity or routine, and that is a part of their being. They're maybe limiting their ability to make money because they don't drive, or their life just has been changed or altered. And so I would say, again, I can't provide specific information without knowing all of the facts, starting with the physician first and then getting a referral. And I have heard of people driving who have had, very severe accidents or were in the accident themselves. They return to being able to drive again. But again, it's multiple modalities or methods of treatment that they can use. And one of the things that doctor said was psychotherapy and cognitive behavioral therapy, as well as exposure training, all administered by a physician and the psychologist that has specific training in those therapy modes. Yep.
Listen is not able to drive. Dr. Swemi, do you have anything to speak about this issue?
Thank you so much, ma'am. The fact is that approach she has given to it is what is important. There is a need for proper evaluation of such an individual. Is somebody just making that diagnosis? Okay, is it an expert that is making the diagnosis? Even though they may be correct, but there may be additional information from the history that could give maybe some extra leads to this diagnosis and maybe more than that. Now, there may be comorbidities, so it's important to check all that too. For example, what are the causes of those frequent accidents? We need to explore that, and if there's a related underlying condition, so that needs to be managed first, and so that gives some reassurance gradually that okay, we are not likely to have repeated episodes of the accidents because we have dealt with the foundational issue. So that's the perspective I'm looking at it. And then she has actually mentioned the different things that could be done. And we still have to talk about medications. Such individuals may even benefit from medications that will help them to calm down. Then the exposure, she talked about that. The fact is that such individuals will benefit more from professional supervision, whether with that psychotherapy and the exposure, maybe a gradual thing to that same situation. Thank you.
Thank you, Dr. Swemi. Thank you, Coach Liz. I appreciate your feedback. So it's like Liz is stuck somewhere, like he was in a shock, but the panic attack refused to let him be. So
Because I think in the chat they're saying that 3 individuals passed away. So
Yes.
that's like compacted trauma. So it's not just a layer of trauma, for instance, the shock and the panic, but like the doctor was saying, it may be other things going on, and medication may be what is needed, depending on the other layers of what happened. So yeah, my condolences to those that lost their lives, but my prayers to those that were affected by it. But yeah, it's definitely a multi-layered situation, and it definitely requires some coordinated care. That means the physicians communicating with each other about this particular client and patient, not just, one person treating in isolation, but they're all working together as a team. And that's another thing that we do within the field of behavior analysis is we coordinate care with speech therapists, physical therapists, occupational therapists, and the pediatrician. We don't just treat the client in isolation. It is ethical and best practice to treat in a coordination of care. So everybody communicating may not be in the same place, but sharing and signing off on certain medical records to be released so that the other physicians are knowledgeable of what is going on currently, and everyone is in the same, if you want to say, incubator, or within the same ecosystem of understanding what is going on and working together to restore this person's life as well as their functionality.
Thank you so much for your submission. We are very sorry, Liz, for what happened to you, but according to the advice you have just received from Coach Liz and Dr. Soyemi, I think there's more to it, and I think you need more and more.
Right.
So I don't know if you are taking medication, but I know I'm not the right person to talk to you about this. You have to get the right people to address your issue, right? Yeah. Given advice from what the speakers have spoken, thank you so much. We appreciate you, and thank you for coming. So this is the end
Right.
of our.
Oh,
Okay, Sweeter, you have something?
sorry. Yes, please.
It's okay.
Sorry,
Go on.
sorry, Lizzie. Yeah, just a follow-up question. So the person I'm talking about now has seen the different specialists. The person is now at the stage of seeing an occupational therapist. So I want to ask a question again. Can an occupational therapist actually help with somebody that is trying to drive again? Because what I used to know about occupational therapists is that they help with children, when they are having difficulties in concentrating in school on writing and all of that. They recommend that they are taken to occupational therapists and they help them, try to write, concentrate and all of that. So can they also help people that are struggling with driving, having those kind of challenges now?
Yeah, depending on their
Because the person,
specialty.
the person has seen a psychologist, has seen a psychiatrist, and they've recommended an occupational therapist, and the person is now seeing an occupational therapist. So I just wanted to know, can occupational therapist actually help with that? Okay.
Depending on their specialty. So, for instance, my specialty is to treat severe behaviors that prevent the children from communicating and also prevent them from being integrated in society. So, that is my specialty, and restricted eating and selective eating is also within applied behavior analysis. And my training, I have advanced continuing education in those two areas. So depending on the occupational therapist ability or their advanced training, they may be able to help with understanding not just the driving per se, because they may even want to talk to a driver's training person. Maybe they have some training in helping people get back to driving after being in an accident. But the occupational therapist should have experience with understanding how their practice will help this person. It should be a treatment plan. So they should have goals set that lead to the end result. So I like to say begin with the end in mind. So they should begin with saying, okay, this is where we want the client. this is where we want the client, and it should be patient centered. So the client should have a say so in their treatment and advocate for themselves. And they should be able to say, in 3 months, this is what I want to do. So are you able to get me to this point with your experience? In 6 months, this is what I want to do. And then 9 months, and then in a year, this is where I want to be. As an occupational therapist, are you able to facilitate any of these treatments or these interventions to get me where I want to go? And if the occupational therapist cannot, maybe they are not the right person for this particular focus of what they want to do, but they can help in other areas like pivoting. They help some of my clients with like eating, making sure that their grasp and their fine motor skills are developed, as well as their gross motor skills. So when you said that, it triggered in my mind, maybe they're helping with the big movements. That's
The
what
big
gross
movement.
motor. Yes, gross
Yeah.
motor are the big movements. So the raising of your arm, the reaching, the grabbing. The fine motor are the more integral pieces, like picking up some paper or being able to tie or screw something together. So maybe they're helping with those motor movements. And that is what occupational therapists do.
So
Yeah,
in
some of
other
them,
words,
the ones that are faced unique, they also teach somebody how to cook. Like, so there's
how to what?
so many areas they can
I
help.
didn't
For
get that, coach.
driving, I have no idea.
You say how to? Did you say
But
how to cook? I didn't hear that.
yes, there's some who
Okay.
are helped
Okay.
on how to. Yeah, it depends on a person what they want to be helped.
Okay. So I wanted to ask.
And depending on the disorder they have as well.
Yes.
Because in
Okay.
some disorders, you cannot be exposed to kitchen like knives and what have you. So
Okay.
it depends on the disorder yeah.
Okay. So that was what I was going to ask that. So it means that in the area of occupational therapy, there are different specialties. People are
They have
Yes.
different
specialized in
advanced
different
training.
areas.
Yeah, they
Okay.
have advanced training in certain areas. So I know that, like I said, when I see them working with our clients, they help with their motor movements and
Okay.
being able to, even with their hand movements, for dexterity. So dexterity is able to manipulate certain objects and move in conjunction with, why you need to manipulate a screw versus why you need to be able to like open a water bottle. And so that's what I've experienced them doing, helping with those, like I said, gross motor movements. Reaching over the seat is a part of being able to drive, because you may have to reach back to grab your seatbelt and put your seatbelt on correctly. So that's movement and mobility, and that's a gross motor movement. And so a fine motor movement while driving is being able to turn on your signal. So all of these things, again, have to be coordinated with the doctor, starting with the physician, because the physician can give you a screening or a test to see if you're even prepared mentally and cognitively, as well as, I don't know, other senses and things that you would only be able to be tested by your physician, to see if your senses and every other reaction is ready for you to get back in under the wheel.
Right. Okay. Thank you very much. Thank you so much.
Yeah.
Very
Yeah.
helpful. Thank you so
Thank
much.
you
Coach.
so
Thank
much,
you, everyone. Thank
everybody.
you, Dr.
Thank you,
Suyemi.
sweetheart, for the questions. We appreciate you. We love when we talk practically and how to do things practically, because this is the way we solve problems. And when you are solving real life problems, that's when you are doing something right. So we are solving real problems, and that is a problem. And we have Liz over here. I hope she has benefited in one thing or the other. So we reach out to each other. We help one another, making impact in other people's lives, improving our lives. So thank you so much for
That's
being
very true,
here.
because what she's saying now is what they actually told the person as well. Yes. So thank you.
Wow. Thank you for that confirmation. Thank you. We appreciate. So tomorrow we are going to come live. You're going to be finding purpose in losing weight at the same time. So pay attention and come and join us and find out how to lose weight without even taking those pills people take and what have you. So many people do, even going to the gym. I'm not discouraging people to go to the gym. Oh, don't say that, but I'm saying there are things you can do moderately and you're able to lose weight. We are going to have Meme over here. She lost 17 kgs. I don't know how much is that in pounds. So we're gonna have her over here tomorrow. And thank you so much, Coach Liz, for being here. Behavior Talks. We appreciate you. We love you. Thank you, everybody who has contributed in this particular live stream, from showing us love, from commenting, from sharing, from tapping, everything. Mama Obejo, thank you. Samara and Trish, I see you. Thank you so much. Mama Wellness, you've made these things so active. Twitter, thank you for the question. Lava Girl, I've been seeing you actively tapping the screen and commenting a little bit. Miriam as well. Orphan Voices, thank you so much. Gracie, I've also seen everybody contributing. Faith Love and Jesse, thank you so much. Bran, I see you as well. Liz, also thank you for speaking out, because some people keep silent. They don't speak out. Thank you for also speaking out. It's very important. Aswika, thank you so much. And so many people who have passed through the live stream, and the ones who have contributed, like Dr. Soyemi, he did amazingly contribution also in this particular live stream. So you're gonna see and more and more and more. Mentioning somebody is already here. Remember, welcoming. You're just winding up. I was just putting good day, Coach. I was telling people tomorrow we're gonna have you over here. We're gonna find purpose in losing weight. So I'm going to say goodbye. You could have not found us. So we are going because you're already late. Maybe the flight has landed. Maybe we mentioned her name and she was brought over here immediately. So guys, goodbye. Thank you so much. And you're gonna have interesting live streams. So feel welcome. The ones who have not followed, follow, so that you get us when we go live. Thank you and God bless you all.